Welcome back to Daniyal Ultrasound Clinic. This is Dr.Muneer Abbasi. Today we are going to perform pelvic ultrasound examination. Unmarried, complaining of pain in loins with irregular menses and backache. On pelvic ultrasound examination, we have this picture. This appears to be right ovary. Right ovary. This is urinary bladder. Do not be mistaken for that. Now let us study this ovary. This appears like ovarian cyst. This is on the right side. A large cystic lesion is seen, measuring approximately 7.2 into 6.2 centimeters. The lesion shows multiple thin septations. These are internal septations, but no solid component or echogenic debris are noted within the cyst. The cyst wall appears quite thin and regular. Let us see in real time. This is how it looks. So the septa are thin. Here is the posterior enhancement of the cyst. Now let's go to the left ovary. This is uterus. This appears normal. This is the left ovary. Again, it is smoothly outlined, showing single septum with no internal echoes or debris, no solid moiety. So the left cyst is also similarly showing single, though there were multiple septations in the right ovary, but here is a single septum and it measures approximately 5.2 centimeters and showing single septum with clear fluid. There are no internal echoes. This is again the right ovary. For the sake of understanding, I am showing you this one. This is urinary bladder. Now, another thing here to note is that there is no free fluid in the pelvic area. Uterus appears normal in size and shape, contour. Endometrial thickness is also within normal limits. How? Here is the uterus showing normal contour. Endometrium is also normal size. There is no sign of fluid or any hyperplasia. Now, how to interpret this situation? We can say that bilateral, thinly septated ovarian cysts are visualized. They are likely functional or benign serous or cystadenomas. So serous or mucinous, this can be done on only histopathology. Otherwise, they can be labeled as cystadenomas. Now the DD, differential diagnosis. Most common differential diagnosis lie with the functional cysts, but they aren't apparently functional cysts. They can be benign serous, benign cystadenomas, maybe serous or mucinous, as I told you, and showing multiple loculations like here you see there are multiple loculations. Septa or loculations are almost same terms used simultaneously at one time or other. And endometriotic cysts can be, but they do not show any internal echoes or thick walls. So they are not definitely endometriotic cysts. And para-ovarian cysts, but they are within the ovary, so they aren't para-ovarian because para-ovarian cysts are adjacent to the ovaries. So here ovaries are occupied, so there are ovarian cysts. This could be differentiated from the hydrosalpinx, but the hydrosalpinx are fallopian tubes. They appear tubular, but they are rounded. So this was the differential diagnosis, and now What advices can be given to the patient? There is a pelvic color Doppler ultrasound to check vascularity or non-vascularity. CA 1 to 5 levels can be done to rule out any early neoplasm, especially if cyst persists over the 8 weeks. So we will advise this patient to come again after 6 weeks to get ultrasound done to assess the size of the cyst. And hormonal profile is very important. If menses are irregular, here she is complaining of irregular menses, so hormonal profile should be done like LH, FSH, prolactin, TSH, estradiol, testosterone. Means total hormonal assess should be done. So after that, we are going to repeat this case or ultrasound after 6 to 8 weeks to check for the regression or persistence or progression of these cysts. Now, this was all from my side, and we'll advise this patient to come again after 6 weeks to decide whether they are progressing or regressing. So, thank you very much once again. Here I'm going to take a little zooming in view, like where both cysts can be seen. Here is the right ovarian cyst, this is the left ovarian cyst, and here is the uterus and transverse section again. So that was all from my side. Thank you very much.